Hey guys, Dr. Redmond here. I'm so happy to have a guest with me today. This is KK Ray. She is a licensed marriage and family therapist, neurotherapist, systems and trauma expert, basically all things health and wellness for your brain. And she is here to talk to us about neurofeedback. She is the owner and founder of Tennessee Neurofeedback, who luckily has decided to share space with us here at Balance Medical and Wellness. So KK, welcome.
Thank you for having me. It is our pleasure to get to be with you in that space, which is a beautiful space, but we are thrilled to be in Nolensville now.
And as you know, the reason I find this like critically important to both my being, but my patient's being, is that when I think about health, I know that the nervous system basically controls all of it. It controls our ability to heal from an infection. It controls our ability to change behavior. It helps us regulate how we respond to medications and supplements and lifestyle changes. And so as you can imagine, this is a huge win for my patients, but I'd love to hear from you, your perspective on what the background of neurofeedback is, how it works, and who would be a good fit for it.
Yeah, the first time I heard about neurofeedback, it freaked me out because Dr. Bessel van der Kolk was saying basically it helps everything. And I'm like, okay, hang on. And when I came back and told my husband that, he's like, I said, it's kind of like voodoo. And he said, I don't think we need to be saying voodoo. But anyway, so in a nutshell, what neurofeedback is a modality that can regulate your nervous system. So it can take a over-aroused, under-aroused nervous system and bring it to what we call a window of tolerance within a regulated state. So that goes down, we know down to the neuron level. So everything you're talking about that you're working on is affected and vice versa. So I'd also be remiss not to say, Susan, we are thrilled to know you more than you're thrilled to know us. And for you guys listening, I always introduce Susan to my patients and clients as the smartest doctor I've ever met in my life. So I know you can laugh and be embarrassed, but it is true that the first time I went to see her, she was drawing these diagrams and putting all these things together, and no one had ever done that for me. So we are thrilled to be able to, and I tell people about you from other places too. So we have people coming in from out of town that come to see her, etc. So anyway, in the nutshell, neurofeedback takes a brain and a neurosystem from a dysregulated state into a regulated state. So what does it treat? It treats anxiety, depression, trauma, sleep,
Addiction, chronic
addiction,
pain, insomnia.
inflammation. There's so many things. And I think that, what we see, we're able to see well, we can get into the steps of it, but I think that'd be more than answering what you ask.
Well, you also brought up an important point, which is it treats so many things. And of course, what I see neurofeedback as is a very important kind of bridge to even help other therapies work better. Do you think you could speak a bit on how perhaps this could be integrated with cognitive behavioral therapy or family systems therapies or medication changes? I'd love to hear that because certainly as your experience as a trauma-informed therapist, I feel that like that's maybe the most relevant part of it.
It really is important because what happens is if you're in a dysregulated state, we can put so many diagnoses that don't really matter
Yeah.
on dysregulated nervous system. And so what's important there is if we can calm that nervous system down and really see what somebody's range of normal is, then we can move further with. And many times I'll have a trauma patient that comes in and there is no need to talk about things. We can talk about it until the cows come home. But if you're in what we call an amygdala hijack, which is in the reptilian part of your brain,
Sure.
talking about it ain't gonna matter. So if we can calm that down, and many times we do that in tandem. So if it's a sleep disorder and we get people sleeping, we can be doing any kind of therapy along with that. And the same holds true with neurodivergent therapies, kids, that anxiety goes hand in hand with so much of this stuff, or inattentive anxiety, or true ADD, any of those things. So if we calm that nervous system down, then we can really be much more effective in what's going on, in the adjacent therapy modalities.
And of course, one of the questions I get most frequently is, how do you know it's working? How do you do it? And does it hurt? Is it scary? Is it triggering? So, like, what's the patient experience like? And certainly for a lot of you, you might know that over the years, have experienced anxiety and pain and grief. I had for some of you, you know that my dad was suddenly hospitalized and got critically ill last year. And so I was able to use neurofeedback as a way to help, like, rely more on my coping strategies. But I'd love from your perspective for you to kind of describe, how do you know where to start, and how does the patient process go? What's the experience like?
So when anytime we tell somebody we're going to map their brain, they get a little scared. Like, are you going to find out I'm a sociopath or something? But the first thing I want to say is that none of it is invasive. We're not putting anything into the system. So the first step, and a really important step, is it's really in my opinion, the most important step to know what to do next. And that's what we call the brain map. And in technical terms, it's a QEEG. So just think, sometimes you get an EKG of your heart. We're doing an EEG of your brain. The brain is electrical, so we're measuring that. The Q means that we're putting it through a database, and we're norming it. You're looking at your brain versus a norm. And so when we get that, and that's just a cap on your head with some gel. You will want to shampoo your hair after, and it takes about 30 minutes to an hour to get this brain map. And then we put it through the database. We have neurotherapists look at it and make decisions, and we have neurotherapists look at it, and they're able to say, okay, is this brain low power? We didn't talk about that earlier. Low power meaning, think of a battery and it's just all browned out. And we see that a lot in peak performance type people. Like, I wouldn't be surprised if yours wasn't browned out when we did
Yep,
your.
it was.
Then we're able to see, is this brain anxious? Is this brain depressed? How is this person sleeping? In the anxiety, we can even tell down to the type of anxiety. Are you worried about something that happened in the past? Are you ruminating about that, or future? And so all of that really informs the training that we're going to do. But the training feels the same to the patient. You come in, we say 40 times minimum, but in 20 session blocks. So we do a brain map. You come in for 30-minute sessions, and you're watching a Netflix show and have feedback tones in your ear. Sometimes people just do eyes closed if they're not watching the Netflix. And what happens is we're getting your brain to move towards the regulated state. So as those neuropathways or the electrical impulses are going in the right direction, you get a feedback tone, and the computer, the Netflix show you're watching, brightens. And so in a passive way, you're getting reinforcement, so that your brain's like, oh, and the brain always wants to heal itself. So it's like, okay, that felt good. That felt more healthy. And it repeats that behavior. So think of kind of like Pavlov's dog, but also like going to physical therapy. So you're reinforcing it, and literally over time, you're growing new neural pathways in the regulated state, and those dysregulated pathways are sloughing off. So tend to be, it's very subtle. It's not going to be a switch that flips. You might have a child I saw a mom the other day, and she said, oh, all of a sudden he's not getting triggered by this.
Mm-hmm.
Or he didn't fight me on going to sleep and he stayed in bed all night. Those kind of things, it begins to be real subtle. Or for my husband and I, we quit having the same little dog and pony show conflict that we'd had for 30 years. It
Yeah.
was like, wow, that didn't go very deep at all. Let's move on, kind of thing. So it's subtle. And then over time, those neuropathways hold and
Mm-hmm.
stay in place. It's not like muscles that if you quit working out, they atrophy. It stays in place. The only caveat to that is if you have another stressor, a trauma, TBI, something like that. And we didn't talk about TBIs, but TBIs are really first line, should be first quickly after any kind of concussion. You should do neurofeedback. Okay, I probably answered a lot more than you asked.
No. I mean, I think certainly, and you and I have talked about this offline too, that by the time people come to see me, for example, they've done everything. They've done the therapy, the supplements, the fasting, the mindfulness. They've done the medications. They've done, they've dabbled with things like ketamine and different things like
Yeah,
EMDR. And for those of you that don't know what some of those are, as you can imagine, in the mental health world, we've been chasing different targets for decades
years.
and for years. And what I think a lot of people want to know at the beginning of any sort of time and money, investment,
Mhm.
like what's it going to be like and how am I going to feel? And I appreciate how you described it as subtle and importantly, like it's making subtle changes where then the brain can heal itself so that over time things will continue to regulate better. And I think I think that's a great description of it because when I think about health in general, like even getting glucose regulated, it's not just about the one like sugary drink that you're cutting out. It's not just about the
Right.
low carb. It's about letting the hormone body respond to food and things differently. Um, would you say there is um, are there like no goes, like no, this person should not do neurofeedback?
That's a real good question. And gets a little bit more. One thing for sure we do not do is somebody that is doing chemo. And the reason you don't do it during, and it's real, neurofeedback is real good for chemo brain, post chemo treatment. But we don't do that because people get better on neurofeedback and it might mask some of the side effects that the doctors would want to know about the chemo treatment.
Sure.
The other thing is with epilepsy, we want to know what kind of, what's going on with that. But by and large, neurofeedback is not contraindicated for anything because all we're doing is moving it towards a more regulated state. Now, sometimes if you're living in a really jacked up system, um, and the brain starts to calm down or act differently within a system, that might be jarring to the system because we're expecting this kid to act a certain way and maybe he doesn't act the same response he used to have. So along that line, one of the things we love to do is treat the parent system first before we identify a kid as or in tandem. Of
Sure.
course,
Sure.
if we can treat everybody, that's best. But we always like to elevate parenting issues or kid issues to the parent system first if we can.
I
Which
think,
many times people don't want to admit that. I can remember being a young parent thinking if I wasn't perfect or was identified as not perfect, that would put me in the bed. So treat the kid.
yeah. Well, I mean, I think all of us think so much about like how well, I mean, of course, we could talk about this offline too, about like how like my relationship with myself and my kids is definitely like generational, and it has a lot to do with like how my parents operated and what their belief system is, and then anyway, so, but of course, you're right that when there is not just dysfunction, but like even when there's just reaction, right? Like a
Absolutely.
child with ADHD or behavior like routine trouble. Like the parents have to have been conditioned to respond in a certain way. And if their brain is not adaptable enough to then see what this new brain child is doing, then it could kind of handicap the process a little.
A little. Yeah. Yeah, that's right. That's right. So that I would say that is kind of a contraindication is that the expectation is that if the kid is the identified patient and shouldn't be, we would rather treat the adult in it. Yeah.
Well, I mean, I can even think of a variety of families where even and vice versa, like can be really relevant. Like you see a parent that overcomes addiction, right? And then their social connection is different, their brain patterning is different.
Yeah.
And so then how they relate to their children and spouse is has changed so much. And I think again the benefit of neurofeedback is that sometimes we are so self-critical of how
Yes.
our brain and body works. Like, I should be able to not be frustrated. I should be able to manage my own addiction because he has gotten better. And so I love the idea of neurofeedback as a way to, like, of course, again, like, as you know, I mean, so Keki's experience in marriage and family systems is like legit like the pinnacle of how to really support every person. Like, none of us operate in a bubble. And so anyway, long way to say I can totally hear how that would be a reason to think about, like, hey, let's go a little bit deeper in the family. What
Yeah.
I do really appreciate, and certainly in my experience with neurofeedback, in particular this type of neurofeedback, is that the kind of brain map is like blinded. Like, you're not getting a lot of upfront history and background questions before making the interpretation of the brain map. And what I like about that, and I know that in some of the studies that's relevant, is it has this almost reproducibility
Right.
where the brain map is really correlating strongly with symptoms, that then after treatment you repeat the brain map, which shows improvement in those areas. I'd love to hear your perspective of perhaps why that's a powerful tool.
Yes, it what it does, one of the reasons I love it, and I could really choke up on this one because it's so wonderful when somebody sees in black and white that it's their brain that's doing it because it's dysregulated and it's not a character issue or a flaw or any of that. I mean, it's just such a gift to be able to go, oh, it's my brain doing that, and it's treatable as opposed to, I've got to white knuckle this reactivity or this attention issue or keep taking massive amounts of sleep meds, whatever it is. This is really what's going on with my brain. That's where it gets really powerful, and it separates the humanness from an organ, just like you would think, my heart's not doing the right beat, the technology.
Exactly. Well, I mean, honestly, and you and I could also talk all day about even like how we have basically mishandled obesity for decades too.
There
That
you
we that we call obesity a problem of unable to manage lifestyle
No
change,
willpower, you don't have
no
any.
willpower, and and certainly a lot of especially women, and actually especially women of color, are labeled as like symptoms are all somatic, when really it's from a background of hormone dysregulation, trauma, like little t and big T, and some powerful genetics. And so again, I like, my science brain is like, I love neurofeedback to say, like, look, here's the data, here's an intervention that treats this data, and then here is the like actual response.
Yes. Yeah, that being so much more objective is really awesome because mental health has never been treated as an objective science. And so this is one that is just thrilling to me to be able to pull that out and calm it. Just the brain map calms you down, and that's a positive feedback loop,
Yeah.
to get the brain in. And so so that's the biggest thing about it, doing the brain map. And then also that informs how we do and where we do the treatment. So
Yeah.
one thing I was going to say is after the first 20 sessions, you'll start feeling better 12 to 15 sessions in, and typically people around you notice before you notice yourself. But then after 20, we remap, and so we're able to quantify how much your brain has changed.
Yeah.
And then we always say, don't stop at 20 because the nerve pathways have not really gotten strong enough to hold. And that terminology might not be the most scientific to say, but we want you to do at least 40, and it's a good thing, to keep the brain going.
I'm interested about, there was a recent article just this week which was talking about basically other brain training that we can use now, well, at any age, but then to prevent dementia, like literally decades from now.
Yeah,
And my perfect world would be like using these brain cognitive strategies with neurofeedback and a variety of things that we know to be helpful, like creatine and a type of strength training and sleep patterns. But I think that like when we really think about like the aging population and the high risk of um, for a lot of reasons increased prevalence of dementia, I love how neurofeedback could be involved. I don't know, do you know any
yeah,
studies about how neurofeedback
yeah.
might be a good
We'd
plus?
we'd have to ask our resident scientist Kelsey for
Sure.
that, but for sure, I love it when somebody comes in and on the brain map it's showing that you have short-term memory issues, or you got parents that have some type of issue,
Mhm.
and you want to be preventative, and then you have a client come back and go, oh wow, I remembered everybody's name that I met this week or whatever. So yes, think of exercising the brain just like you're talking about, no sugar, the inflammation, all the things that they're finding, and neurofeedback is just a really good modality to add to that.
You probably know what question I'm going to ask next, but is all neurofeedback the same?
um, well, glad you asked. Someone described neurofeedback as the wild, wild west one time to me. It's not regulated like we would like it to be. So the answer is no. It's not. And there, there have been people here in Nashville that have um, been salesmen and bought a franchise and hung a sign up. So what I would say is the best practices is that you're with somebody that has some type of license in mental health or in medicine, and they are specifically trained and certified to administer neurofeedback. And that those would be the questions I would ask. And one of the things I'm really proud of that we worked really hard on is that we stick with best practices. Did that answer that question?
It did. I mean, I think that, like I said, like one of the benefits of being kind of in this like integrative world is that I am able to both experience and hear lots of patients' experiences with a variety of modalities. And I appreciate the need to be both open-minded and understand even where the barriers are in researching things like integrative modalities. Actually, there's a lot of frustration around how hard it is to design amazing studies to kind of prove benefit and or most importantly also prove like correlation with harm. But I think what can happen is, like you said, because there is some flexibility in licensing and or not licensing, actually practicing without a license, that is something that I think is really important to bring up. So thanks for sharing that.
Yes, yes. And yeah, that's exactly it. Yes, and you'll feel better. You'll see the difference in somebody that's put the time, energy, and investment financially and otherwise into it. You'll see the outcome being better.
Well, I think now you've answered all my questions about who's a good fit, why to do it, what the data shows, what the patient experience is like, how safe it is, what the long-term benefits are. So what am I missing? What else would you tell me about for neurofeedback that you think?
Well, let me just show you. If you hear something huffing and puffing on the thing, unfortunately, Rudy came back from his walk, and so if y'all are alarmed watching this, it's not me hyperventilating. It's Rudy being here. Sorry. Um, the only thing I would say, Susan, is that it's a very powerful tool to put in the toolkit. It's not the end all be all, but man, it helps all the other tools, and it is really a great one. It's been around a long time. There's not these massive studies because big pharma does not fund big studies, but there's a whole lot of research out there about how good it is. I would say, you know, if nothing else, do a brain map. It'll help inform everything else that you're doing and expose you to it. And it's um, a fairly inexpensive way to break into it.
And I think, like you said, and even how like I think about how important it is to kind of have almost the we need to have assessment catch up with like the data. So like we've known for years that BMI is not an appropriate assessment
Right,
of like
right.
metabolic health. We've known that high cholesterol is not actually the heart disease risk. And I think that when we think about even like, and as you know, and a lot of my patients have experienced this too. That yeah, there are questionnaires. There's PHQ-9, there's GAD-7, there's ADHD adult scores, and there are diagnoses that, and you mentioned this too, that could be thrown on, but that doesn't assess like your cognitive function. And so the benefit of the brain map and then hopefully ultimately the neurofeedback is you get real time data of where I'm at and where I could be. And so I echo that. I think getting a brain map and seeing where not even weaknesses, but maybe inefficiencies are is a great
That's
place to start.
and that's a perfect word. Let me give one example that tends to hit home with everyone. So your child gets an ADHD diagnosis based on subjective information that you've given them, the school's given, and
Yep,
all.
the Vanderbilt score, the parent does it, the parent does the assessment, the teacher does
Yes,
the assessment, and with that, a clinical doctor or provider will make a diagnosis of ADHD.
right. Okay, so then we put a kid on a stimulant. All right. Now you get a brain map and you can tell is it anxiety or is it an inattentive anxiety or is it true ADHD?
Mm-hmm.
And it's not, we don't say the brain map's diagnostic, but it's really good information. And so think about you put a kid on a stimulant that's already very anxious.
Mm-hmm.
He's going to feel horrible. He's not going to sleep well. And the minute he gets to that young teenage year and somebody gives him a puff of weed or a beer or a drink of alcohol, and all of a sudden his anxiety calms down
Mm-hmm.
that he's been having anyway and then stimulating that anxiety. We're off to the races
Yeah.
with a kid going through, every barrier it is just to get the brain calmed down. And the brain is then going to be in a feedback loop that says, get me more of that because that feels better.
Mm-hmm.
So my whole dog and pony show on that is much better to have a brain map to see what's really going on before you stimulate a brain.
And that, I mean, obviously, we could talk about all of this all day too, because that's also this like idea behind personalized medicine and really thinking about identifying as much as you can about a person's like strengths and inefficiencies or weaknesses so that then you can tailor the treatment better. Because as you and I both know, there are non-stimulant ADHD therapies too that could be synergistic. Like you could still rely on medication so you don't have to be in that long-term waiting game of like, well, when will I feel better? Because one of my mentors in med school said, hey, Susan, the person can feel better first and continue to work on the root. And what he meant by that
Yeah.
is let's not like throw all meds, all traditional therapies out. Let's help a person feel a bit better, to have a bit more hope, and also work on the things that could be really synergistic long term.
And what happens there is you don't need more meds. You start to need less meds. And
Yeah.
we love that.
Well, I've really enjoyed our time today, and I really look forward to continuing to work together in the neurofeedback and integrative medicine world, and really appreciate your time today.
Thank you for the vote of confidence for us too, Susan.